Yeah, I think before you can answer that directly, we need to take a step back and talk about where healthcare disparities are in cancer right now. And it's a growing field, especially as we look at patient-focused care in oncology. But it's really been at a peak recently with ASCO releasing a set of initiatives focused on healthcare disparities. But in kidney cancer in particular, there's a very limited number of resources to look to. And there's some evidence to support clinical and pathological differences based on ethnicities in kidney cancer, but nothing that focuses on the treatment itself. And so being at City of Hope Comprehensive Cancer Center down in the LA area, we have access to a really diverse patient population that allows us to look at some of these outcomes that haven't been done yet. And so we were able to look at 300 patients retrospectively from our database and break them into three main ethnic categories. First being Caucasians, which we accounted for about 60% of our group. 30% were Hispanics, as you might expect, and the last 10% were Asians. So we were able to look at four different metrics of treatment-related response. The first being disease control rate, the second being objective response rate, and then also progression-free and overall survival based on first-line targeted therapies in the metastatic kidney cancer setting for these patients. And the good news is we found no significant differences across the groups for any of these metrics, right? And I think that's a very promising assessment of the landscape of healthcare disparities in kidney cancer, but unfortunately it's also not the end of the debate, right? And the first thing we need to do is rely on multi-institutional collaborations to prospectively validate this finding. And then second, we need to focus on what the true goal of this research is. And that's going to be to find a way to focus on identity-focused care for these patients as a system with patient-focused care to increase outcomes for every patient that we see in the clinic.